VA research really championed ghrelin, which is a hormone that has to do with hunger and satiety, and that was a big breakthrough. There was also a multi-center Alzheimer trial that the VA partnered with other institutions around, as well as the big diabetes studies. So these broad-reaching clinical trials really were championed by the VA, and I think really changed the way that we think about doing research, and that research has benefited not only veterans, but it's changed the way we think about partnerships around improving recruitment to clinical trials. There are a number of programs, but I think the one that's going to have be just transformational, not just now but in the future, is the Million Veterans Program, because essentially what that program does is take the genes of these veterans and it combines it with information, health information in the health record, with their military exposure. In a sense, you can get a complete snapshot of them to help predict future risks and treatments, what treatment would work best for whom and why, and this will go on and on and on. And imagine 1 million veterans. So this will really change the national landscape of not only how we deliver care, but it will also inspire new kind of research into precision medicine in how to treat various diseases or how to predict susceptibility to those diseases. So I would have to say that that's been a major breakthrough. There are, I think, around 114 medical schools or academic health centers, about 124 VA relationships. And I have to say, in my mind, because I experienced it sort of on the ground, it's really a model of how institutions, one more federal, whether it's public or private, can come together and really enhance the research in both arms of the institution. So I think it's been a remarkable, long-standing commitment. With the AAMC, the VA created a unique working committee to look at data sharing policies, and it's really balancing complete sharing of data with the human protection of confidentiality. And I think that really will stand the test of time in how to share data, especially as we get into these multi-site clinical trials that are going to, I think, be the research of the future. Now there's a lot of attention on patient-centered outcomes research, comparative effectiveness research, implementation science, and actually the VA has been at the forefront of thinking about what are the most effective strategies that we can compare to determine what works best for whom and why. And then once they've decided what's the most effective strategy, whether it's prevention or a drug or a device, then they do exquisite research into how to implement that into routine practice across the VA. So now, with this new emphasis on comparative effectiveness research, I think the VA really led the way. And not only that, but they were able to use comparative effectiveness research to really integrate a meaningful evidence base into how they delivered care. And I think that we're seeing the benefits of that now. And I think part of the legislation with the Affordable Care Act reflected the comparative effectiveness research program that the VA had championed years before.
VA Research, improving veterans' lives.